listening to your show.
The point that there's limited news
I just want
coverage.
to know what your viewpoint is.
Do because major news organizations have been told on, what they can report on.
The people's voice. Welcome back. Welcome back. I am Trey Evans, the people's voice. Thank you for tuning in again for another episode of the podcast. When we left off last week, I was going through the 5 causes of poverty in America. And what I wanted to do to continue that conversation was to then offer or at least discuss some of the solutions that have been presented to assist with alleviating poverty in America. And just as a quick background for maybe of those of you who are catching the second part of this and haven't had a chance to listen to part 1, I do encourage you to go back and listen to part 1. I went through the 5 causes of poverty in America, and I'll just quickly state them here. So the 5 causes of poverty in America are: number 1, lack of access to quality jobs. Number 2 is housing and lack of quality housing. The third one was abuse of drugs and alcohol. The 4th was education or lack of quality education or access to adequate training and education. And then the last one was health, because health and medical expenses play a huge role in the difference, or at least one of the causes of poverty in America. And I'm specifically talking about America. Obviously, poverty has no boundaries, and any of us who know anything about the world, and you don't have to be a world traveler to know this, you know that poverty extends to every corner of the world and affects every race, color, creed, religion, social class, so on and so forth. So that's what I covered last episode. So this episode, what I wanted to do was focus on some of the solutions, at least the solutions that have been presented, that have been discussed. Some have been enacted, some have not. And, I thought that would be a good discussion to have today because, I'm really about solutions, right? We all know what the problems are, but I'm a big solutions person. I'm not really one to pontificate on just problems. I'm always focused on solutions, right? Because there are always going to be problems with what are the solutions. And obviously something as big as, or something as huge as poverty in a country, let alone in the world, is a huge task. And no one solution is going to bring it to an end. But I do believe that if you are applying a little bit of this and a little bit of that, kind of like if you're making a dish, or, you're seasoning food, for those of you who cook, or, really those of you who eat, what good food tastes like. It's a combination of things that make the food taste great. And I'm a firm believer that when it comes to problems, there can be multiple solutions to bring the problem to an end. So today I wanted to focus on the solutions surrounding poverty in America. And I guess I should just go in order from what I discussed last week in terms of the causes, and maybe I'll just do it like that because there are so many different solutions, and it could really become a long and drawn out discussion here. So I want to just stick to the I'm going to stick to 5 solutions, just like I presented 5 causes of poverty. I'm going to stick to 5 solutions and kind of present what has been discussed, and we'll go from there. So, one of the first causes of poverty, as I said, was lack of access to quality jobs. And when I was talking last week, I was, talking about the working poor, and some of the assumptions that many people have about poverty is they think that, well, people that are in poverty is usually a circumstance of an individual having no means of employment or not being able to work or things of that nature, but that's just not the case. Many times, especially in America, and again, I'm focusing just about America, many people that are in poverty have income. They just don't have the income that allows them to sustain a lifestyle that is a lifestyle that allows them to have access and a quality of life is what I'm trying to search for, an adequate quality of life, because they just don't have the means, the financial means to keep up with the cost of living in an expensive country such as America, right? Things in America are very expensive. And when I say things, I'm just talking about basic needs. I'm not even talking about luxuries or other items. Some of the wants of life, right? The needs are expensive in America, right? Just basic housing and food and access to utilities and internet. Those are basic needs, and those are very expensive. The luxuries for somebody who is in poverty or are among the working poor are astronomical. And that's a whole nother conversation in terms of how money is spent. But let me stick to what the discussion is today. So the first topic was lack of access to quality jobs. And lack of access to quality jobs is one of the causes of poverty in America. So how do we solve that? Well, one of the first ways that has been proposed here recently is an adjustment, first of all, to the minimum wage. And I want to first discuss those individuals who are working and how to help or assist with bringing them above the poverty line. So it has been discussed and has been passed that the minimum wage in many states is just too low, and it has been proposed that all states raise their minimum wage eventually to $15 an hour. Now, $15 an hour is a wage that will allow individuals to come up in terms of what their current wages are, right? It provides a little bit of breathing room, but it really doesn't provide, in my opinion, the necessity for an individual or family of 4, let's say. If you have 2 individuals making $15 an hour at an 8-hour job, I don't understand or see how that could possibly get someone above the poverty line, particularly in the economy that we're in now, where inflation has increased dramatically since COVID-19, and rents are, through the roof. And typically, when you're talking about someone who is making, a minimum wage, you're talking about somebody who's probably renting or living in inadequate housing, because $15 an hour, 8 hours a day, 5 days a week, that's $600 a week. You're looking at what, $2,400 a month. $2,400 a month with two kids. That's $28,000 a year. If it's two individuals, now you're at $56,000 a year, $57,000 a year, and you still would be considered someone who is just barely over the poverty line with four kids. But if you have, or I should say 4 members, but if you have 5 members, now you have $57,000 a year. You're still below the poverty line. So, one of the ways that I, feel that we can tackle poverty in America, especially among the working poor, is that we should propose a living wage, right? And the living wage, in my opinion, has to be somewhere between, $18 and $22 an hour. Now, once you start proposing those type of numbers, first thing everyone says, well, okay, well, if you propose a $20 an hour wage, and you're doing that for every job, who's going to pay for it, right? Well, that's where the conversation, as far as me, that's why the solution is so difficult to implement, because when you put that in place, or that requirement, that means that everyone has to agree that there has to be an increase in how much is charged for a service or a product, and how much is then paid to that employee. Now, will everyone agree to that? That's where it gets tricky, right? Because in order for that to work, you need agreements from not only the employers, right? And this is federal employers as well, because many federal jobs, up until the mandate to get to $15 an hour, were not paying $15 an hour for their minimum wage, right? So you need to have a buy-in from not only the employers, all right, but you also need a buy-in from consumers, because consumers will ultimately have to eat the cost for having a higher wage paid to employees. But I firmly believe that if you're paying a wage of $20 an hour, I think that's more than a livable wage. That's $800 a week, $3,200 a month. And at the same time, from an annual perspective, you're looking at $38,000 a year. You do that with two individuals making $38,000 a year, and you're probably looking at something close to, what's that, 70, probably 72, 70, 76, $76,000 a year. Now we're talking about money that allows for an individual family to not only be able to comfortably take care of their needs, but also allows them to participate with gathering some of their wants, right? And, that is one way that I think, in terms of the cause of poverty is access to quality jobs. Let's look at raising the wage for the working poor from not just a minimum wage, but raising it to a livable wage. And I think that with that initiative in hand, that is one way we can begin to curb some of the poverty in America caused by lack of jobs. So that's my first suggestion. The second point that I reviewed last week, and again, for those of you who might be tuning in the middle of the podcast, I am discussing poverty in America. And last week, I talked about some of the causes of poverty in America. And this week, I want to focus on the solutions to poverty in America. And the second cause of poverty in America is lack of affordable housing. Now, here in the United States, particularly even before COVID, the housing market was very expensive. It's incredibly expensive for a individual making a minimum wage to get quality housing, right? And quality housing comes with a cost. And if that cost is not being addressed through programs such as rent stabilization and things of that nature, then that leaves many families living in inadequate housing areas and just inadequate housing all around, which then can lead to further complications, because without inadequate housing, that kind of has a snowball effect and leads to other issues. Matter of fact, let me play this clip. This is a story about a woman who lives in Portland, Oregon, and she basically details what can happen or some of the setbacks that occur from not having adequate housing and what adequate housing can do in terms of lifting her out of a state of poverty. So let me play that clip.
I want to get a house so I can set my goals. Now my goals are I want to get back in the medical field. I want to do something for my kids. Just a lot. So I want to be stable so that way I could get a better job.
And that's just one case, obviously, out of, unfortunately, millions of cases in the United States. That's why adequate housing is so important, because it allows individuals to have a foundation, somewhere where they can begin to plan the next steps, somewhere that has stability for themselves and their families, and allows them to begin to build and to climb their way out of a state of poverty. So what's one of the solutions for adequate housing? Rent stabilization is one that has been used for decades here in the United States. But it's really about building quality housing in centers where there is sufficient access to not only affordable housing, but also to some of the other resources that are needed in order to maintain adequate housing, which, include education and healthcare and things of that nature. So, relieving the burden of inadequate housing is a challenge. But if policies are targeted towards providing quality housing, not even quality housing, consistency. I like to use the terms consistency in housing, right? There should not be a drop off in the type or quality of housing as you just navigate from community to community. If there is some type of consistency, and I'm not saying that everyone needs to live in a luxurious neighborhood, and I'm not saying everyone needs to live in a neighborhood that's inadequate, but there should be some consistency with the quality of housing, and this starts with programs that can be produced from a public or private standpoint. But in terms of the solution, I firmly believe that consistency in the quality of housing needs to happen, and then it needs to be affordable, right? It needs to be regulated to a place where individuals who are making a livable wage can have adequate housing consistently. It should not be a case where if an individual loses his or her employment, that, in less than a month, they no longer have housing. If you provide affordable housing, I firmly believe that can help with some of the bumps in the road, so to speak, to help an individual sustain quality housing for themselves and their families. And many of these changes come not only from the private sector, but a lot of this has to come from the public sector as well, right? There have to be policies that which are already in place, but those policies have to be enforced and be on a consistent basis to protect renters and to protect discrimination of individuals who have a minimum wage incomes, and also rental protections that are currently in place but are not being enforced, to force landlords to honor some of those policies, to regulate some of the discrimination in terms of individuals based on color, or to discriminate against based on former past incarceration records. And there's even source of income there's even discrimination because of source of income, because when you are on a fixed salary, on fixed benefits, there's certain income levels that you have to maintain, or you are not eligible for benefits anymore. So a lot of this has to be a combination, just like anything else. It has to be a combination of the private sector and also policymakers. But number two, in terms of solutions to ending poverty in America, is providing lack of quality and affordable housing. The third cause of poverty in America, which, again, just to recap, last week I was discussing the causes of poverty in America. I went through the 5 basic causes. I shouldn't say basic, but the 5 common causes of poverty in America. And just to quickly recap as we get through this, there were 5 that I decided to identify. One was, lack of access to quality jobs. 2, lack of access to quality housing or affordable housing. The third one is drug and addiction. 4 was education, and then 5 was healthcare. So right now I'm covering the solutions to those causes, and what I am up to now is the third cause of poverty in America, which is drug and alcohol abuse. And I always want to emphasize drug and alcohol because, so much, I guess, conditioning has been done to where people don't believe that alcohol is a drug. It's become so part of the social experience that many people discount it, but it is just as addictive as any street drug. And I've seen this firsthand. I know individuals in my personal life and in my professional life that have an addiction to alcohol. So I want to make sure when we talk about substance abuse, we are talking about drug. We are talking about alcohol as well. As a matter of fact, I did a podcast about that. If you want to check that out, a couple of weeks ago about alcohol. But the third cause of poverty in America is alcohol and drug abuse, and this is a tough solution, right? Because the addiction is caused as a result of many of the causes that I've already discussed in terms of poverty, right? Those pressures that come from not having housing or quality job and education and healthcare issues. Many times when you have an opportunity to talk to these individuals, one of the things that they have turned to is drugs and alcohol because, it provides escapism, right? It's a moment to not have to deal with some of the issues that they are having a hard time overcoming. And so in terms of the solutions vary and are very difficult to implement on a consistent basis because so many factors go into it. Many times when individuals who have drug and alcohol addictions, in order for them to qualify for various programs that will allow them to become recovering addicts and then move on into lives where they can maintain a job and housing, a lot of those programs require that they first become clean for a certain amount of time. Well, if you don't have quality housing and you don't have adequate employment, and the requirements of the program are that you get clean before you can then access those additional benefits. If you don't have those adequate things in place in terms of jobs and housing, you probably will still have to deal with the addiction, and you'll be seeking out what you know, right? This is what you become conditioned to. So, a lot of times with the policies that are in place, I think one of the solutions is that we have to attack it from put the resources in place first and let's deal with the addiction, right? Because doing it in an opposite fashion has proven not to be effective. Has proven not to be effective in the United States as yet. So that's one of the solutions. One of the things that I would recommend, and that policy, and many states and countries around the world have taken this approach where let's put the resources in place, get these individuals adequate housing and employment, or at least adequate housing and supervised employment, and let's work on the addiction in that standpoint. Because the other way around, in my opinion, doesn't work. Because once a person gets to a point where they have a control of their addiction, then if they don't have the adequate housing, you send them back into the communities, and we see this a lot of times with inmates who leave prison. You send them back into the same communities or environments that they were in when they adopted the addiction, and ultimately they go back down the same path, which again leads to a circle of poverty and inadequate access to jobs and quality housing. So this is required by policymakers to enact policies that provide these programs, really taking a deep look on how effective these programs are. And then from a private standpoint, having the private sector donate money. And of course, the money that's donated, they would be looking for tax advantages, but have that money donated to have these programs in place so these individuals can have a fighting chance to really get over the abuse of drugs and alcohol and have abundant lives here in America. Also the education of drugs and alcohol, I think that plays a huge role. I again, as I stated when I was starting this topic, it's so uncommon, or not uncommon, but in the United States, the conversation about drugs and alcohol, it's become so much more of a social event that no one really discusses the ramifications of becoming addicted to drugs and alcohol. Now, I know, people are listening and saying, well, no, they talk about cocaine and heroin and this drug and that drug, but again, and I'm emphasizing it, alcohol is a drug and it is addictive. And I've seen people ruin their lives because of it. And I think more education needs to be provided about that. And now with the legalization of cannabis, that's going to be the next addiction, which is going to lead to an abundance of individuals living in a state of poverty in the United States. So that was the third solution. Again, addressing the substance abuse issue in America, or crisis, I should say, in America, is another method to assisting with ending poverty in America. The fourth issue that causes poverty in America is the lack of education. And kind of to piggyback on what I was just saying about additional education needed to enlighten the population about the seriousness and the causes of, I should say, the effects of substance abuse and how that plays a role in how one gets into a state of poverty, or how an individual can prevent themselves from becoming in an impoverished situation in America. So education of all kind is super imperative when it comes to relieving or alleviating poverty in America, because but specifically education. And when I'm talking about education, I'm speaking specifically relating to schools, and this is K through 12, because poverty is a cyclical process, particularly when you're dealing with education in families and communities, right? Because if the education is inadequate to start, how is it to be perceived, or how is it to be understood that a child growing up in a community or in a household that is experiencing poverty is now placed into an educational system that is inadequate and does not provide them with the necessary tools to be able to go out into the world and produce a sufficient income to raise themselves and their families out of that condition. And I want to be very clear, because I've said this a few times. I am not an individual who believes education is a silver bullet, but I do firmly believe that in the early stages, or in the development stages of a child, that discipline that education provides, and the insight what quality education provides, and I want to emphasize that, right? Not just education, not just talking about colors and history and ABCs and 1, 2, 3s, but education that provides insight, that forces thought, that develops critical thinkers. That's quality education, and I do think that's very important, particularly in the K through 12 spaces, and that's from kindergarten to 12th grade. Those spaces, it's very important, because then those lessons and disciplines and training can be applied as they go out into the world. Now, whether they take those educational skills or those skills that they develop at that level and decide to go into a higher education, or just to go out into the world to build a business, or to begin their career journeys, that's the decision that they should have. But when you are dealing with inadequate education to start, and you're coming from an environment that doesn't provide you with the necessary resources to become these things, or to get this training and discipline, how could we expect anyone to be able to elevate themselves from that. So that's the problem. Now the solution. So I think in terms of the solution, and this has been proposed many times, quality education starts with funding. And in the United States, we know that funding of education is inadequate. It's inadequate. It's not equitable. It is not balanced. And depending on the neighborhood that you live in, will dictate the level of funding that your school or your school board or school district receives, which then has a direct correlation of the level of education that you may receive. So I think in terms of changes, that's one of the things that we need to examine and to put forth. And that's, again, going back to policy and making sure that our voices are heard when we are, when elections are upon us or other objectives and laws are being debated. Those have to be put on the table in terms of how schools are funded and to get adequate funding. Besides that, there needs to be additional funding from the private sector, right? We, as citizens of the United States, cannot wait on government to make changes for us. We all know how slow the government is. So in order for exponential change to occur, and this is a large task, so I don't want to in any way try to minimize this as if this is something that can be done overnight. But I believe that many people in the private sector have a responsibility as well, and many companies do it, but more needs to be done, and private citizens as well, to provide additional funding to these schools that's outside of the federal funding or even the state funding. Provide private funding, and it should not have to result in somebody deciding to create a private school and then charging an exorbitant amount of money for the private school, right? And that's a whole nother conversation about education being commoditized. But I firmly believe that if there are private institutions and private corporations and citizens that have the means to provide additional funding to schools in areas that provide inadequate education, that we really can turn the tide and begin the process of alleviating poverty in America being caused by inadequate education. Again, education is not the silver bullet, but it is the foundation to a life for individuals and children that will allow them to pull themselves and their families out of poverty. And I strongly believe in that aspect of it. So just going through, we're almost at the end here. Again, just to recap, I'm going over the 5 solutions to alleviate poverty in America. Last week I was talking about the 5 causes. So this week I wanted to kind of offer solutions. Again, these are just the 5 that I've chosen. There are a ton of conversations about causes and solutions for ending poverty in America, but these were the 5 that I decided to highlight. These are the ones that I feel the most passionate about, and so that's why I am kind of covering those here. So number 5 is one that I don't know if everyone knows this. Well, usually the podcast community, those who seek and listen to podcasts are seekers of information, right? That's why you guys are listening. That's why I listen to podcasts. And so you probably all know this. And for those who may not know, this is new information. There's nothing wrong with new information. But one of the other causes, and which is in the top 5 causes of poverty in America, is healthcare and medical expenses. We do not live in a country that provides universal health care or universal medical benefits. And in order to be treated for some of the illnesses, to stay alive, really, it requires a lot of money. And medical costs have driven many people into a state of poverty. The cost of medication to treat illnesses, the operations to cure or to at least temporarily address certain illnesses and other challenges that come from medical ailments is very expensive. Even after insurance is paid or insurance is provided by an individual, the out-of-pocket costs can be astronomical. I mean, you know, some averages or some estimates say that, you know, just to stay in a hospital for a night can be anywhere between, you know, $350 to, you know, $1,000, depending on, you know, what hospital you stay in and what's going on. You know, the cost of a pill can be $15 and $17 and $18 for a single pill. This gets expensive, and we're not even getting into some of the more serious ailments like, cancer treatments and diabetes and heart and liver transplants and things of that nature. It gets very costly. And especially when you have a chronic illness, because those chronic illnesses require medication in order to treat the illness, right? Because one of the, I guess, I don't want to call it secrets, but I guess one of the unknown facts, or again, in terms of discussion, I don't think is discussed enough, is that, you know, pharmaceutical companies don't create medication to cure, right? Many medicines are provided just to help you cope with your illness, right? Because there's really no money in the cure, the money's in the sickness. But that's a whole nother conversation, and I don't want to go down that rabbit hole. But medical expenses and healthcare issues can lead to a life of poverty. So how do we abstain from that? That's very difficult. When you are in a poverty in an environment where poverty is prevalent, you don't have access many times to quality health care, because in order to have the illness treated, you have to be able to access facilities that can adequately diagnose and to treat the illness. That does not occur oftentimes in communities that lack these type of resources. So one of the biggest things that I preach is about preventative health. And preventative health comes from diet and exercise. Now, I know many people will say, well, wait a second, I don't even have access and I'm saying people in communities of poverty don't have access to purchase food that is in line with a healthy diet, because oftentimes access to fresh fruits and vegetables are not within walking distance. Many times in these communities, access to vehicles or even public transportation, it takes quite an effort. So I understand that. But if you are able to get to a place where there is quality foods, vegetables, fruits, that is definitely one way to stir the tide of eventually developing some sort of illness that's going to cause a state of poverty. Also exercise as well. Exercise can be done in so many ways, and I love it when I go to various neighborhoods, sometimes that are of low income neighborhoods, and I see some of the community out there doing just workouts in the park, right? Just using whatever is available to continue to work out, to continue to try to stem the tide of eventually developing an illness as a result of poor exercise or diet. So that's one of the solutions. And how that's done, again, from a policy standpoint, putting policies in place that require neighborhoods to have access to these resources, or at least making sure that they have transportation available to get them to the areas that have access to grocery stores that have fresh fruits, vegetables, to areas to building parks that have the ability for them to walk or run or be able to work out to maintain their health. So that's definitely one of the solutions that I recommend. In terms of the billing practices, listen, the cost of medical the cost of medical help in the United States is outrageous, and I detailed some of that just a few minutes ago. Some of the cost. We have to begin to hold these hospitals and medical facilities accountable in terms of what they are allowed to bill. And this is, again, I'm not saying that this is a easy task and this is something that can just be easily done with a swipe of a pen over conversation. This is going to take a long time, but it has to be addressed, because if a person is struggling to pay the basic necessities of life, right, just to keep a house, a roof over their head, food in their stomach, clothes on their back, you cannot expect an individual to now also maintain a high coverage of insurance to ensure that if there's an issue, they'll be able to have the money to deal with an illness, right? So we have to begin to put more pressure on these medical facilities, on to these insurance carriers, and also on to our public officials to put legislation in that requires medical facilities to not put these type of financial burdens on those who struggle with paying their monthly bills, especially when it comes to the elderly, because many elderly individuals end up becoming part of the community of poverty, because when they develop sicknesses, they don't have the financial means to be able to support those causes. I mean, to support those issues. So we really have to begin to examine that aspect of it. There's been so much conversation about medical debt, and coming up with more clever ways to reduce that debt, which just goes back to what I was saying in terms of reducing medical expenses. This really has to be at the forefront of our conversations when it comes to poverty in America. And then in terms of healthcare itself, again, and education plays a huge role. It has to be more healthcare education that is presented to these communities to warn them and to alert them of some of the challenges that will come when the diet that is consumed on a regular basis, what that can lead to further down the line, because I don't think there's not enough education in terms of what a poor diet can do to lead to further medical complications down the line. So those are the 5 solutions that I would propose. I could talk all day about this because it's such a huge topic, but I don't want to minimize it and just say, well, here's the 5 solutions, here's the 5 causes, here's the 5 solutions, let's just do it. But I think it's food for thought. I think it's a start. It's a start of a conversation or a continued conversation with many of these solutions. But it is time for us to act as individuals, as members of the community, as citizens of the country. poverty affects all of us one way or the other, right? So even if you may be listening to this and you say this has nothing to do with me, but it does though, because each citizen that is adversely affected by poverty becomes a responsibility to the community at whole. And if you don't think that you are affected by it, I would caution you and tell you to look at this issue a little bit deeper to see how it affects you directly. So that's my time today. I hope you enjoyed this conversation. I hope you've been enlightened a little bit by it. And, we're going to continue to work here at the People's Voice to bring these type of topics to the forefront and continue to do the work to help eradicate some of these issues. But as always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute, the People's Voice.